As you know, October is Breast Cancer Awareness Month, and the purpose of the month is to raise awareness about the importance of early detection. But often the happy news gets lost amongst our fear. If caught early, breast cancer is 100% treatable and survivable. Dr. Mala Singh is a family medicine specialist, and she is here to help us fight our fears. And I love the angle you want to talk about this from, because it seems that fear prevents a lot of us from doing those checks that we know we should be doing. What are we afraid of?
Well, I want to clarify first that fear is very understandable. So I don't want the women that are afraid right now to feel that, oh, I'm feeling something wrong. It's a scary thing. Breast cancer is scary, but things are improving overall for us. Women are now going with all the awareness in October. They're going and getting their screenings done. But the biggest fear is just finding the cancer. When I send a woman for a mammogram, her biggest fear is what are the results? Am I going to have cancer? And God forbid, it's over the weekend, they start planning their funeral. But they have to understand that breast cancer is no longer a death sentence. It's very treatable, caught early, and that's the key. Getting the mammogram and getting it done early enough and having annual mammograms.
So yes, it happens, but yes, there are things we can do about it. So let's talk about risk factors, because I think we all need to understand when we have some of those, the importance of the check is even more vital.
Yes.
So what are the risk factors?
Some of the risk factors are increasing age, genetics, the BRCA1 and BRCA2 gene, family history. If you've had an abnormal biopsy previously, that's another higher risk factor. One of the main risk factors I'm seeing now is obesity, which is it's a whole talk by itself, but obesity is a big contributor to breast cancer and other cancers as well.
Will there be pain? A lot of friends have said to me, I don't need to do that, I don't have any pain or anything.
No, most breast cancers are found are asymptomatic. Sometimes there'll be some tenderness, but most cancers, no, there's no pain.
And is there always a lump? Because some of the other things I have heard girlfriends say is, well, I do the self-breast checks and I don't find anything, so I don't need to go.
Well, that's the beauty of mammograms. They can detect lumps which you would not feel on a self-exam.
Okay.
So early diagnosis.
You mentioned mammograms. Another thing, people are afraid of that. And I know we were talking before, but you said the technology has changed where it's not as painful or invasive as it was at one point.
Right. The newer machines now, the digital machines are, they don't compress as hard as they used to. So if your mammogram is painful, then there's a problem. So it should just be a little discomfort, but it should not be uncomfortable or basically painful.
Okay, all good advice, because we know we need to do the checks. It's just sometimes hard to get the motivation and break down the fear, because it does make sense. Let's talk about the rest of our body, because as women, we're probably not real good about paying attention to signs and symptoms. What are the other areas of concern that females especially need to be watching for?
Well, the thing is that, ladies, we have breasts, yes, but we also have the rest of the body we need to take care of. It's not only about the breasts, right? So we take care of them, but then we also have heart disease, which is we wanted equality, and with men, and we've gotten it, even as far as as heart disease.
We didn't want this equality, by the way.
And they're saying more women don't, is an increasing number of women are dying from heart disease, that, you know.
Yes, they are. And what's happening is in most women, when they go to the physician, it's kind of ruled off as anxiety, or you had a panic attack, or you're just depressed. So the signs and symptoms can be very subtle. I had a patient once who just had a little tingling in her chin, and she was having a heart attack. So they don't usually get the normal, the Levine sign that the men do, have chest pains.
So what do you do as a physician? Is that detectable through blood testing?
I take it very seriously. If a woman comes in and she's got fatigue, sudden fatigue, doc, I was feeling great, now suddenly I cannot explain this fatigue. First thing I do is an EKG and try to rule out if there's anything. And even if the EKG is normal and they have persisting symptoms, I send them to the hospital or to cardiology.
Wow.
I don't chance women's health at all. It's very important because the signs are so subtle, and sometimes they can be regular signs like chest pain, but mostly women don't have the signs men do.
Yeah, one of my friends had heart issues, and she was diagnosed with acid reflux.
That's a big common one.
Yeah.
Anxiety or acid reflux, that's what they'll attribute it to.
Before we wrap up, we know that women put everyone but themselves first. How can you encourage all of us to try to remember to take the time time to take care of ourselves?
Well, the thing is that women are caretakers, they're nurturers, they are used to taking care of everyone, their children, their spouses, and now we're seeing a trend of taking care of older parents. So it's really important. Caregiver burnout is a real diagnosis, and it's really important for women to start nurturing themselves first, because remember, ladies, if you can't take care of yourself, how can you take care of anyone else?
Great advice, great advice. And that's for all of us as friends and supporters to remind ourselves of. For any of your healthcare needs, you can go to the Gulf Coast Medical Group website. Thank you so much, Dr. Singh. That was a very great conversation. We love to empower our girls to take care of themselves. All right, speaking of empowering, Mickey always has great treats for us, and I hear some of them are special birthday edition ones. So we'll see what she has brought to share with us when we come back.